The Uganda Virus Research Institute has discovered the presence of the congenital rubella syndrome in several children aged below 5 years. This mysterious condition, which retards mental and physical growth, causes swelling of the head and is said to be as a result of the fetus being exposed to the rubella virus during pregnancy. These are the children who have been found with the congenital rubella syndrome, according to Dr. Barnabas Bakamutumaho. In the 20 children they investigated, over 90% were exposed to rubella virus during pregnancy.
Roughly, say around 20 children we've investigated so far over a period of time. We've confirmed that in over 90% of them, there was exposure of the rubella virus during pregnancy, and certainly the cause of the congenital heart disease.
He warns that the rubella virus is very common in our environment, but people mistake the syndrome to measles.
The rubella virus is one of the common viruses we have in our environment. Because it's a disease which more or less resembles the way measles disease manifests, only that for it the presentation is usually mild. Very rarely the presentation is in a severe way. Often what is eventually confirmed as rubella, many people would think it is measles.
Here at the Entebbe Referral Hospital in Wakiso district, Florence Ayebale says her son was born with the syndrome and she didn't know until he was 7 months.
I didn't realize breath was not okay in the beginning until it was around 5 months when they said baby is supposed to start speaking. When I used to put him down, he could not sit. He was like falling in front. He was falling on himself like this. And when in the earlier months, when he was crying, when he used to cry a lot. But when he used to cry while turning the back like this, instead of falling like this, he was turning at the back like this.
It is unclear whether the disease is genetic or caused by a virus. For Florence Ayebale, the syndrome has been noticed in her family before, and her children's condition leaves her mentally disturbed.
It was August 2016. Then I came here 2016 in November. November was ending. That's when I started. So far this is the second year when we are undergoing therapy.
As these mothers toil with their children, Lois Musinguzi, whose daughter is now 2 years old, says ever since she enrolled for therapy at Entebbe Referral Hospital, her baby's mental and physical growth rate has improved.
It is a very challenging moment that she's not walking when she's already in the age of walking. You need to carry her, you feed her, and do everything as if you are feeding a baby, as if you are doing with the baby, and you go when she's old. Yeah, but something is big right now.
According to Dr. Barnabas Bakamutumaho, congenital rubella syndrome presents conditions such as visual and hearing impairment, mental retardation, holes in the heart, swelling of the head. Prevention is through immunization and heart surgery to correct the holes in the heart.
If, for example, you have like 100 women unfortunately exposed during their early pregnancy to this virus, 100 pregnant women, in over 90% of them will have an outcome of this child who has one or more of these complications, which is really very unfortunate. You can only prevent it through vaccination program.
Dr. Stanley Wobukira says some of the conditions can be caused by other infections, injuries, premature birth, and substance abuse during pregnancy.
It is, of course, usually caused by congenital rubella syndrome, but it can also be due to other infections, including substance abuse during pregnancy, and other infections in early childhood. Injuries also can be a cause, and birth trauma and premature birth.
This is the case for Catherine Nakagwa, whose 5-year-old daughter got an accident.
Melissa was born normal like any other kid, but accidentally she got an accident while they were putting her upside down by the doctors. So she got the blood mixed with the water inside the brain. So the veins got blocked, the head started expanding. Not until I saw the head is widening, I went to Mbale for operation.
Dr. Stanley Wabukiri confirms that out of 32,637 children in Wakiso, 62 children were found with multiple sensory impairments. So 132 health workers and 62 VHTs were put in place to help in the identification, plus modern equipment installed at Entebbe Referral Hospital.
Medical doctors, nurses, laboratory staffs in this area of service. We also have trained empowered 60 VHTs in the area of deaf blindness, and these have been helping us with identification of such cases in the communities and then referring them to us. I should say that we have also had some equipment added on to our supplies within the sector. The latest equipment that we have had is an ABR machine, which is very good at screening for these cases. It costs a lot of money, and was received a few weeks ago, and is going to be installed in Entebbe Hospital.
According to 2011 health survey by the government of Uganda, up to 10% of the population has some form of sensory impairment. Now, rubella has been eradicated as a cause in the UK, yet it remains a major challenge in many African countries. This report was compiled by Joseph Omagol for New Vision TV.